In the surgical approach, most dental implant surgery procedures are performed in the dentist practice or in the hospital setting. Local anesthesia is adequate enough to complete the procedures. The surgeon is need to take the X-ray to show or to check the shape and thickness of the jawbone and position the other structures in the mouth, such as nerve or blood vessels. And maybe X-ray is not enough to provide enough information, so it take CT scan to show the other structures in the jawbone. There are different approach to placement of the dental implants after tooth extraction. Number one, two-stage surgery, delayed loading procedures. Number two, one-stage surgery, early loading procedures. Number three, direct flapless one-stage surgery. Now in this slide show the two-stage surgery, also called delayed loading or submerged approach, in which the implant body is completely embedded in the bone and is attached by the cover screw and is covered by the oral mucosa. And after 3 to 6 months healing period in which the implant fused to the bone and also to permit to the osseointegration to completed, there is another surgical procedures occur where the implant is exposed surgically and the healing abutment is attached and the prosthetic phase of the treatment was completed. In this surgery, the implant body is used with the surgical method is usually two base implants. This surgical approach allows the pre-implant tissue to heal without loading. Is used when there is poorer pulpone quality or quantity. There is some advantage in these procedures. Number one, minimize the risk of infection because the pre-implant tissue is allowed to heal separate from the oral microbial environment. Number two, implants are allowed to heal without loading or micro movement for a period of time to allow for osseointegration to complete it. Number three, ability to bone graft the set at the time of implant placement because use the bone graft to restore the bone loss. Number four, local hygiene issues or anaerobic bacterial infiltration are not critical factor during initial healing because it's covered by the oral tissue. Number five, the crystal and facial region may be directly evaluated as second stage uncovered surgery and minor defect corrected before beginning the prosthetic reconstruction. And there is another disadvantage of two-stage surgery اللي هو delayed loading. أولا بما أنه سوينا عمليتين فهذا تعتبر من disadvantage اللي هي أولا further surgery is needed. ثانيا compromised aesthetic, therefore a temporary prosthetic should be constructed especially in the anterior region, يعني يحتاج إلى temporary restoration خصوصا بمنطقة الانتيريور region. ثالثا it is the longest period of treatment, يحتاجها وقت طويل للعلاج. Now in this slide show the image about the one-stage surgery, also called early loading or non-submerged approach, because the corner part of the implant is positioned above the crest of the alveolar bone and passed through the peri-implant soft tissue and left uncovered and exposed to the oral environment during the healing process. In this technique, a restoration can be attached immediately to the implant or it may be attached later. When use this procedures, there is some indication to use this procedures. When number one, when the bone quality is good, and number two, good initial implant stability. Number three, they are also used when a cosmetic is not a concern, such as the back area of the mouth. It means it can be used in the anterior region. There is some advantage of the one-stage surgery. Number one, this method is placed without surgical opening the gum to have access to the jawbone. Number two, the implant is to the abutment to implant connection may be placed above the crest of the bone. This higher connection of implant or abutment connection may be reduced some of the early crystal bone loss. Number three, the prosthetic procedures is simplified and less chair time because there is no secondary surgical. Number four, the prosthetic phase can start earlier because there is no wound healing period. And there is disadvantage of one-stage surgery, of course. The implant is exposed to the oral environmental, which may lead to contamination of the surgical set. Number two, the implant may be exposed to the trauma because its negative effect of the healing. And the bone graft is considered at the time of implant insertion. One-stage approach is less indicated. And number four, the implants mucosal extension or healing abutment may be unaesthetic when it's located in the aesthetic zone of the mouth. In this image show the direct flapless one-stage surgery, also called immediate implantation, because the placement of the implant into the bone without soft tissue flap reflection and no required to the suture after implant placement. In the flapless surgical technique نستخدم a round tissue pinch is used to remove the soft tissue on the crystal bone على crystal bone at the implant set equal to the size of the implant crystal diameter. بس نشيل على قدر الامبلانت body السوفت tissue remove من عندها. نقدر implant can be placed on the same day as the extraction if good amount of bone is available and if there is no any infection around the extracted tooth. نقدر نخلي الزرعة بالوقت اللي نسوي extraction للتوث ورأسا نخلي الزرعة. إذا بعد ما نتأكد أنه البون يكون متوفر يكون جيد وماكو أي infection around the extracted tooth. طبعا هاي العملية بيها advantage وأهم advantage بيها أنه ماكو عملية جراحية فبالتالي حتحافظ لنا على الهارد والسوفت تشو تحافظ لنا على blood supply تحافظ لنا على inter-operative bleeding ما حيصير أكو bleeding وحتحافظ لنا على reduction تقلل لنا معاناة البيشنت اللي هي منها swelling أو pain. Disadvantage of flapless surgery اللي also called immediate implantation اللي هي أولاً inability to assess the bone volume before or during the implant osteomy or insertion. عدم قدرة رؤية البون فوليوم قبل أو بعد أثناء الإمبلانت osteomy بعد أن نخلي أو قبل أن نخلي الإمبلانت osteomy or insertion. Number two, risk of damaging anatomic structures لأنه تكون الفتح حنسويها المقدار removed of the soft tissue فتشي كلش قليل فما حنقدر نحدد knife bore teeth root ما حنقدر نحدد damaging knife bore structures والimportant nerve or the science فما نقدر نشوفها فهاي حتكون disadvantage. Number three يسموه also called plain technique يسموها plain technique ليش؟ لأنه look of flap reflection on the small diameter of the mucosa open لأنه مقدار قليل من الميكوزا حنفتحها فما حنقدر مثل ما قلنا بالخط قبلها النقطة أنه ما حنقدر نشوف الروت والنايف بور التوث روت وما حنقدر نشوف الستركتشر البقية الأسنان. Now discuss the step-by-step surgery. Number one, soft tissue reflection. أول خطوة هي soft tissue reflection. بعد ما نحدد المكان اللي نريد نخلي به الزرعة فالsoft tissue reflection أول شيء نسوي له. نحدد المكان قلنا وبعدين line incision line is extended through the interproximal and sulcar tissue of the adjacent tooth. يكون اللاين اللي يكون بين بين الأسنان المجاورة من interproximal يبدي إلى and sulcar tissue of the adjacent teeth. وعندما نتأكد أن quantity of the attached tooth is adequate and the underlying bone expected to be sufficiently weight إن يكون العرض للبون يكون كافي. حنسوي simple crystal incision is recommended. نفضل أن نسوي في simple فتشي كلش قليل من الرفلكشن للsoft tissue. هاي أول خطوة. Now The second step of the surgery اللي هي drilling والإمبلانت اللي هي اسمها الثاني implant osteomy اللي حنبدي بعد ما سوينا soft tissue reflection حنبدي بالعملية الدريلينج اللي هي الإمبلانت set is prepared with a series of gradually enlarged pairs حنبدي بيها بسلسلة من مختلف الأحجام من البيارات. أول ما نبدي all implant system have an initial small diameter أول ما نبدي بالبير small diameter اللي يكون حجمه 2.5 ملم diameter ها أول شيء. بعدين ما أول initial drill بعدين يبدي يزيد يصير 3 ملم بعدين يبدي يزيد يصير 3.4 ملم بعدين إلى نوصل للفاينل diameter اللي هو 4 ملم twist drill to prepare location and angulation of osteomy يعني نهاية البير آخر شيء 4 يكون حتى نحدد مكان الزرعة حسب حجم الزرعة. بعد ما كملنا عملية الرفلكشن للسوفت تيشو بعد وراها الدريلينج هسه وضع البليسمنت of the implant. The implant is screwed into the place to add a precious torque so as not to overload the surrounding bone. هنا نستخدم التورك precious torque حتى to overload the surrounding bone which may cause osteonecrosis on the failure of the implant. هذا specific screw key is utilized for the operation. نستخدم فد key خاص على مود هذه العملية. Fourth step of the surgery اللي هي soft tissue adaptation اللي هي after placement of the implant specific healing device is screwed into the implant. There are two possible alternatives اللي هو أولا healing abutment وبنستخدمه بالone stage surgery والثاني هو الcover screw بنستخدمه بالtwo stage surgery. healing abutment الone stage surgery هذا pass through the mucosa اللي يكون فوق الميكوزا اللي استخدمناه بالone stage surgery and the surrounding mucosa is adapted around it والميكوزا حتكون حول دائرة حتى تهيئ للريستوريشن النهائية. قلنا بالعملية السوفت تيشو ادابتيشن نقدر نستخدم بالهيلينج ابوتمنت بالون ستيج سيرجري وبالعملية الثانية اللي نستخدم التو ستيج سيرجري نقدر نستخدم الكفر سكرو اللي مثل ما شرحناها بالتو ستيج سيرجري اللي يكون is flushed with the surface of the dental implant ويكون covered بالسوفت تيشو وبعد العملية السيرجري الثانية exposed and removed the cover screw and instead by the healing abutment. هاي بالخطوة بالعملية الجراحية الثانية نقدر نستخدم هذا cover screw. So the final step بالsurgery هي temporary restoration. After the procedure is completed, the temporary restoration is constructed. It take about 3 months to after the implant fused to the bone and osseointegration is completed. The temporary restoration is placed above the abutment of the implant. Thank you for listening. Do you have any question?